When I was 4 years old, my parents took me and my fair skin to Hawaii. Well, guess what? Sun and my skin don't mix. The first day on the beach, I got the worst sunburn of my life. After that learning experience, it was only thanks to my parents' constant vigilance about sunscreen that my skin stayed protected for the remainder of the trip. Every day since then, I've followed that example, and luckily, I've managed to avoid getting the most common form of cancer in the US, skin cancer.
We focus on the three most common types of skin cancer. The three most common types are basal cell carcinoma, squamous cell carcinoma, and melanoma. There are many different causes of skin cancer. For the vast majority of patients who have basal cell cancer, it's overexposure to the sun. And usually that exposure occurs during early childhood or one's early teenage years. Squamous cell cancers are also mostly caused from sun exposure, but usually a cumulative or lifetime exposure, meaning a person who lives, works, has their recreative activities outdoors. These are the people who are more likely to develop squamous cell cancer of the skin than other types of skin cancers.
Though some people are genetically inclined to be at risk for skin cancer, they have a family history or are born with fair skin and a lot of freckles and moles, the most significant factor is excessive exposure to ultraviolet light. Each time you get a sunburn, you can actually see the redness and inflammation of your body trying to heal the damage that the ultraviolet rays have done to your skin cells. So it's no surprise that the cells then start to act a little strangely.
So the question of what time frame to look out for things that don't heal or things that change over time, and patients do ask this question constantly. The normal response that I give them is a pimple or a cut or an injury should heal in a normal healthy person who takes care of themselves within about a week. However, something that persists for longer than that, say a month, 2 months, even 6 months, is something that should seek medical attention. And very commonly people will come in complaining that this particular sore or mark was there, then it went away, then it came back. So the waxing and waning nature of these things is really what should bring a patient into the doctor to be evaluated.
It's a good idea to have your doctor conduct a skin check during your annual physical. They'll look at your skin from head to toe, under your hair, behind your ears, on your back, between your toes, and they'll catch things you just can't see on your own. And remember, it's possible to get skin cancers in areas that have never seen the sun or where the sun don't shine, so to speak. If you find it early, skin cancer is one of the easiest cancers to treat and survive.
There are many different treatment options for skin cancer. Most of them involve surgical managements, and there are many different techniques that can be used to remove skin cancers. Some of the different treatment options for skin cancers include something called a wide local excision, which is the same type of technique used for melanomas. Typically, that procedure is performed in the office, usually under local anesthetic, where a margin of what's considered healthy tissue is excised around what is perceived to be the roots or edges of the skin cancer.
Some smaller skin cancers don't require surgery and can simply be frozen and scraped off or burned. Some can be treated with topical creams. For more serious cancers, some patients may need radiation or even chemotherapy. If you don't have skin cancer yet, you can take plenty of measures to ensure you never get it.
Prevention of skin cancer is crucial in educating our patients and the public, but the bottom line is protect yourself as much as possible, which means wear sunscreens, preferably that have a broad spectrum of protection against ultraviolet rays, wear protective clothing, wear a protective hat that provides shade, and also seek shade during the peak sun hours between approximately 10 a.m. and 2 or 3 p.m. We also encourage patients strongly to do self-examinations at home so they become familiar with the moles and spots on their skin so they can spot something should it change.
When it comes to sunscreen, most people aren't applying enough. In order to get the full effects of that SPF number on your bottle, you need to apply a shot glass amount, about 1 ounce of sunscreen to your entire body. In addition, if you're at the beach, you should be reapplying every 2 hours, since the water reflects and intensifies the sun's rays. And don't think that just because you have a t-shirt on, you're immune from the sun's rays. A cotton t-shirt has only an SPF of about 8. Pretty flimsy. And if you have kids, lather them up from head to toe. The most severe skin damage happens in the early years. So I guess I should thank my parents for making me look like the only kid in Hawaii that commuted from Siberia. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay pale.